When we administer CPAP for COVID-19 patients, CPAP typically is delivered non-invasively with a CPAP machine. However, in low-resource settings, when machines are unavailable, one may consider creating a bubble CPAP system with common respiratory equipment. Neonatologists have been using bubble CPAP for decades in spontaneously breathing neonates with respiratory distress syndrome. But unlike traditional CPAP, which provides a constant airway pressure, or positive end expiratory pressure, or PEEP, bubble CPAP transmits small amplitude, high frequency pressure oscillations around a mean airway pressure, or PEEP. These pressure oscillations are created by gases bubbling through the air-water interface, and some suggest that these small amplitude, high frequency oscillations aid in alveolar recruitment, though this is controversial in adults. In this video, we're going to propose a modified version of bubble CPAP for adults suspected of COVID infection, adapted from a proof of concept article published by Dr. James DeCanto and his colleagues in the International Journal of Emergency Medicine in 2019. Here's the equipment you need: a bottle of sterile water, a measuring tape at least 5 centimeters in length, corrugated low resistance tubing, a CPAP face mask with straps, a viral filter, an inline end tidal CO2 monitor, a Y-type connector or adapter, a syringe. First, let's set up the system. Starting with the face mask, attach the viral filter for COVID suspected patients. Then attach an inline end tidal CO2 monitor. Then attach a Y-type connector or adapter where one arm connects to the wall oxygen and the other arm connects to the corrugated tubing, whose open end will need to be submersed in the water column in the bottle. An appropriately sized syringe is useful to wedge the corrugated tubing in the bottle's neck, specifically so that the tubing does not slip out and stays submersed. Next, let's set up the water column. Attach the measuring tape to the side of the sterile water bottle and adjust the water inside the bottle until the water level is 5 centimeters from the bottom. Insert the open end of the corrugated tube to the bottom of the bottle as the tube depth correlates to the water column and PEEP. So, a 5 centimeter water column will give you a PEEP of 5. To increase your PEEP, increase the water column by adding more water using your ruler. For example, a 6 centimeter water column will give you a PEEP of 6. A 7 centimeter water column will give you a PEEP of 7, and so on. After putting the face mask on the patient, dial up the wall oxygen until you see gentle bubbling in the bottle. Bubbling confirms that the flow of oxygen is sufficient enough to carry any exhaled carbon dioxide from the patient out of the corrugated tubing into the water. Finally, some tips. Sometimes you don't have a Y-type connector, so you can use a T-piece and 2 pieces of corrugated tubing, one being the inspiratory limb and the second being the expiratory limb, which may also create more ideal laminar flow. To better titrate FiO2 and avoid hyperoxia, use an oxygen air blender if you have one. Also, to prevent drying out the airway, use a bubble humidifier attached to the wall oxygen or air source. Finally, you can consider attaching a pop-off valve to prevent high pressure buildup and potential pneumothorax.